Breastfeeding is natural, but still takes time to learn for baby and for mom. Sometimes you just need a little help to get on the right track. Take it from a mom who knows. You may be wondering if you have enough milk for your baby. I wondered the same thing when I started nursing. It's a common question. Most moms do have enough milk, but sometimes it's hard to know for sure. First, it's important to know it's all about supply and demand. The more baby drinks at the breast, the more milk your body will make. The key is to feed your baby often and drain your breasts each time. To do this, you need to make sure the baby is latching on well to your breast. What makes a good latch? A public health nurse would be happy to check your baby's latch for you. A deep latch that is comfortable for you is important. You'll know your baby's getting a steady flow of milk when you hear rhythmic sucking, followed by swallowing. How often should your baby be feeding? Watch for important cues. The best signs of hunger are increased alertness, sucking and rooting, and when your baby brings their hands to their face or mouth. These early cues are important, but if your baby cries, it's usually an indication they wanted to be fed sooner. How long should they feed? Every baby's different. Babies who suck rapidly may feed for shorter periods on each side. Babies who pause frequently may need to feed longer on each side. The key is effective milk removal. Have a public health nurse observe your baby's feedings. Before you know it, you'll be able to read your baby's rhythm. How do you know your baby's getting enough milk? The first thing you should know is most babies lose up to 7% of their birth weight in the first few days, before starting to regain their weight on the 4th or the 5th day. Most babies are back at their birth weight by the time they're 10 to 14 days old. A great way to ease your mind is to check your baby's weight every week for the first month or two. You'll also learn the signs for when your baby has had enough milk. Satisfied babies are calm, happy, and growing well. They may settle and sleep for an hour or two until the next time they feed. It's perfectly natural that all of a sudden your baby may want to feed more often. It's likely a growth spurt. These occur at 10 days, 3 weeks and 6 weeks, and 3 months and 6 months. It's a lot of changes, but remember, you're not alone. If you have any questions or need any help, public health nurses are there for you. Just call or explore more at www.healthunit.com.